A person may have a normal HbA1c, normal fasting glucose, and normal body weight, but still he can be pre-diabetic. There is one marker that can detect pre-diabetes much earlier than all this to start to change, and that is triglycerides. Triglycerides are not only useful in detecting a pre-diabetic state much earlier, but also they are one of the most underrated cardiovascular risk markers. In fact, elevated triglycerides may be one of the earliest warning signs of a metabolic dysfunction. Most people think triglycerides are simply fat in the blood, but triglycerides are actually a metabolic overflow signal. What are these triglycerides? So these triglycerides are body storage form of energy. Whenever we eat excess calories, especially from sugar, refined carbohydrates, alcohol, or ultra processed foods, the glucose enters the bloodstream. If the body immediately needs energy, glucose is used up. Some glucose is stored in the liver and muscle in the form of glycogen once it is not utilized. But once glycogen stores becomes full, the liver converts excess glucose into fat. This process is called as a de novo lipogenesis, which basically means instant fat formation from excess carbohydrates or from any other source of macronutrients. This newly formed fat becomes triglycerides. The liver then stores some fat inside cells, causing fatty liver, and sends some fat into the bloodstream as triglycerides. These triglycerides then contribute to belly fat, visceral fat, or fatty liver, and finally it may cause insulin resistance. One of the biggest misunderstanding is that fat intake alone increases fat deposition. Actually, in most people, excess sugar and refined carbohydrates are the major drivers of fat deposition inside our body. So especially fructose is important because fructose is almost entirely metabolized in the liver. It has nowhere else to go. So when there is an excess fructose is taken up, it rapidly converts into fat inside our liver. So alcohols behaves in the very similar way. So triglycerides are not only influenced by food, but there are also some genetic involvement. Certain genes like ApoA5, ApoC3, LPL genes, these can increase triglyceride production and reduce triglyceride clearance. Triglyceride to HDL ratio is an important ratio that we have to look in our blood markers. That is triglycerides divided by high density lipoprotein, that is a good cholesterol. One of the most useful metabolic markers. So a higher ratio often correlates with insulin resistance, metabolic syndrome, fatty liver, very high cardiovascular risk. Generally, lower is better. So below 2 is metabolically healthier. About 3 to 3.5 suggest insulin resistance. Very high ratio suggests significant metabolic dysfunction. And this is especially important in South Asians because they have a normal BMI, and this ratio shows how fat behaves in their body. So now let's see how to reduce triglycerides. The most important treatment is source control. That is, reduce your refined carbohydrates. Carbohydrates themselves are not necessarily the problem, it is the refined carbohydrates. Reduce your fructose load, especially from sugary drinks, fruit juices, desserts. Third is the weight optimization. Even thin individuals with high triglycerides may be overweight for their own metabolic system. Exercise. Exercise improves insulin resistance, it helps in triglyceride clearance, and helps in fat burning. Sleep is the most underrated thing. Poor sleep may worsen triglyceride clearance. Reduce or completely stop alcohol. Sometimes stopping alcohol alone dramatically improves triglycerides. There are some medications which helps to lower triglycerides, but these medications do not do the source control. They should be act as an adjuvant. These are fibrates, omega-3 fatty acids, statins, GLP-1 medications, diabetic medications. But an important thing is to understand is that these medications reduce triglyceride numbers, but they are not always address the root cause. So lifestyle remains the foundation. Triglycerides are not just another cholesterol number. They are a metabolic overflow signal. When triglycerides are elevated, your body is telling you the liver is receiving more energy that it can safely handle. So whenever you see a high triglyceride, don't just think about cholesterol. Think about your liver health, fatty liver, visceral fat, insulin resistance, metabolic overload, or metabolic inflexibility. And remember, diabetes does not suddenly start when glucose rises. It often starts much earlier with insulin resistance, fatty liver, visceral fat, and rising triglycerides.